event. We are very proud to have as our guest today Daniel Aldrich from Northeastern University. Oh, by the way, my name is Sanneke Kuipers. I'll be moderating this session. I'm from the Crisis Governance track. I see some familiar faces there. Thank you for coming. Professor Aldridge is an award-winning author of worldwide fame with unrivaled expertise on the effect of social capital on resilience during and after disaster. Daniel Aldrich has been doing field research in the United States as well as in Africa and South and East Asia, thereby greatly enhancing our knowledge on the importance of the social fabric of communities facing disasters of all kinds. It's actually been many years since I first came across Daniel's work, and it struck me how he ingeniously combined well-known insights from political science and sociology in a creative and innovative way by applying these insights to disaster-stricken communities across the globe. He carved out how these communities can cope better and recover better, and how societies can prepare themselves and what makes a crucial difference when extreme weather or industrial accidents or seismological hazards strike. Daniel found a way to leverage existing data and map resilience potential, and he found robust results in a large variety of cases by combining methods, sources and approaches. So I warmly welcome him here at our Faculty of Governance and Global Affairs, Daniel Aldrich. It's an honor to have you with us.
Thank you so much. Can you guys hear me at all? Okay, great. Thank you all. It's a tremendous pleasure to be here for the first time. And just in case there are questions or comments or you really hate this presentation, my email address and my Twitter feed are here on the front page. So you can leave now if you want to and email me and tell me how bad it was. Let's save you the time. Or if you have questions as well, I'll answer them. So feel free to reach out on Twitter or on Facebook. For a lot of us, our personal and professional lives are quite separate, if we're lucky. In my case, though, that was not what happened. In fact, one of the reasons why I'm in the field of crisis and disasters is because back in 2005, I went through one with my family. This is actually my old house in New Orleans. You might recognize those painting there on the front. That's when FEMA went through my house looking through dead bodies. Good news, there were no dead bodies in the house. We had all gotten out. But we had just about 2.5 hours to evacuate our home before water filled it to the second story area and destroyed everything. Clothes, hard drives, my thesis. Don't ever put it on a hard drive, by the way. Use cloud storage. Right? So that process really changed my thinking. And I began wondering, well, if we've gone through this process of getting hit by a shock and trying to build back, how similar is our experience to that of people in Asia or into Africa or the Middle East? And in fact, I had a very naive vision of what would happen, right? I had this vision of one of two people saving me and my family. I thought perhaps what would save me would be some kind of individual preparation, right? I'd be ready to go, my kit would be there, I'd have water, and my hand crank charger with my solar power batteries would be there, and we're all going to be outside, we're getting it done with our grid, right? That's very much the individual level of preparation. The other side of this is the market is there somehow, right? The market, I've bought insurance for my house, I have health or other kinds of insurance, right? That's the individual level. This very naive concept that maybe our individual level would save us. And the other thing I thought that might save us would be the government, right? Maybe the government would come through with aid or with assistance. This image actually comes from Japan. The grandmother that's there, we call in Japanese an oba-san. And that oba-san is about 1.2 meters tall. If you use her as a measure of height, right, that's about 4 oba-san tall. That's about 14 meters. So the Japanese government built 200 kilometers of this kind of protection around Tohoku, Japan, and told everyone, don't worry about individual level preparedness, we've got this covered. So one level of preparedness is your own individual work, your kit, your insurance. One level is the government's involvement, these kind of large-scale investments. And my own experience, and that I've found around the world, is someplace in between. I would argue that what really drives our ability to thrive and survive during a shock is not us as individuals or us as government agent members, but rather as members of a community, of a network. And importantly, there are different types of networks that we're part of. And we call these bonding, bridging, and linking social ties. So bonding social ties connect people who are quite similar. So people from the same ethnicity, background, religion, race, country, went to the same school together. They're in the same family together. Those individuals share strong bonding ties. The good news for humanity, though, is that we bridge beyond those immediate ties of family and race and ethnicity to people different than us. We call those bridging ties. We also call them weak or thin ties, not because they're not as effective, but because they're often less used or they're harder to build. So we have these thicker bonding ties, and we have these thinner bridging ties. Now, bridging ties often come through institutions. It could be a university like Leiden. It could be through a club you join, like a soccer or football club. It could even be from a church or a mosque or a synagogue. Those are all ways to build these kind of bridging ties. But where bonding and bridging are horizontal ties, linking ties are vertical. Those are ties from us as normal people to people with power and authority. In fact, we walked by the Prime Minister's hut, I guess you'd call it, maybe the little tower over there, right? So if you know the Prime Minister as he's biking on his bicycle in his jeans, you recognize him, and he says hello to you, that's a great form of this linking tie, when you know someone with power and authority. Now, how do these different types of ties make a difference during a shock? After any major disaster, the first choice made by a survivor is whether or not to go back to a damaged home, a damaged business, a damaged area. Imagine you're a business owner, your business is now destroyed, your home is underwater from a flood. If you move someplace else and begin again, your clientele can start afresh, there's no damage there, things might go well for you. But to go back to a damaged business, to go back to a damaged home means you may have no clientele, no electricity for weeks or months. It could be a very long time before things are normal again. For a lot of survivors of shocks and disasters, they use what we call exit, right? Exit means rather than staying in the area, rather than working with the individuals, we move out and we go someplace else. For some individuals, though, whatever the costs are of rebuilding, they decide to stay there and work. Call that voice. Why would you use voice? Why would you stay in a damaged home? Right? You might be living in a tent, you might be living in a trailer for weeks, if not months. Typically, those individuals who want to use voice, those are individuals with strong social connections. They feel the sense of place. Their family lives nearby. They know the barista at the Starbucks around the corner. They have family, friends nearby. That sense of belonging keeps them there. So the very first choice that we hit, exit or voice, is driven very strongly by these kind of bonding, bridging, and linking ties. Next, many of the challenges that we face during these kind of shocks are collective action problems. That means no one individual can solve them by him or herself. If you have any involvement in clubs or bridging events, you know how hard it is to get everyone to sit down. This event being a good example. How do you get all the students to show up at the same time? How do you get all the faculty to be here? It's really hard, right? We've got busy lives. So what we need to do then to have those connections, the easiest way to make those is to have bonding and bridging ties that make it easier to coordinate activities. Imagine that there's a flood going on and you've got a meeting planned. Try to bring those two together. The only way to get that done well is to make sure you have those connections beforehand. In communities that are better connected, we see better coordination of their activities. And finally, these kind of bonding, bridging, and linking ties bring both mutual aid and informal insurance. Oftentimes, the medical provision, healthcare, childcare, even gasoline are shut down for weeks, if not months, after a major shock. So how is it, right? Where do we get the process from that we have? That's my bag, by the way. How do we get the process from where we have access to those things? We get access to them because we have friends, family, and connections who can provide them to us. We call that mutual aid or informal insurance. Now, this is all very abstract. I'm going to give some examples of how these work during a shock. So if you remember back in 2017, there was a major hurricane down in Miami, Florida. In fact, that is that red dot area on the edge of the country. Now, everyone in that red dot, those are cell phones in an area that's about to get flooded by that hurricane. And over the 5 days before the hurricane arrived, the government said over and over again, please evacuate, leave your homes, get out of Miami. The good news is some people did leave. See those blue dots? Those are cell phones of people who left Miami and went to safer locations. The bad news is that a lot of people stayed. That big red blob you see on the 8th of September 2017, they were still there in Miami when the hurricane arrived. So obviously, even before the disaster arrives, we want individuals to listen to government advice. Who listens to government advice? Who takes evacuation orders seriously? So sorry it's hard to read, but we measured using Facebook data for over 1 million people who was more likely to leave before the disaster arrived, who stayed there until afterwards. What we found was the following. Individuals who had broader and more diverse networks, individuals whose connections were not just bonding ties, not just family and friends, but they had connections to people that thought differently than them, that sounded differently than them, maybe that have different political parties than them, those individuals tend to leave. In contrast, people who primarily had bonding ties, people who sound and look like them, those individuals stayed in place as that hazard came to them. Meaning, even before a disaster arrives, our social networks are driving our behavior. If you're lucky enough or deliberate enough to have a broad network, a diverse network, then you're more likely to leave and be safe someplace else. If the only information you're getting comes from people who look and sound like you or like me, probably you'll be among those red zone people still in the dangerous area. That's the very first stage. So even before the disaster arrives, these kind of ties make a difference. Our lab has also studied the triple disasters in Japan from March the 11th, 2011, when there was a 9.0 magnitude earthquake, followed by a huge tsunami, about 20 meters, and then nuclear meltdowns at Fukushima. Now, this image comes as that set of waves came ashore. For the communities along the coast, this was one of the most serious tragedies they faced in the last 100 years. 18,400 people lost their lives in this tsunami. And the obvious question is, what happened in terms of variation in mortality rates? Did similar communities across Japan's northern coast have similar rates of death? The good news is that most communities in Japan had 0% of the people killed. That means everyone left, everyone evacuated, everyone was safe from that tsunami. The bad news, though, is that in some communities, 1%, up to 5%, and even more than 10% of the community was killed by that very same wave. So obviously the question is, why is it that in some communities, we have 1 in 10 people perishing, and in other communities, everyone's getting out safe? Perhaps you're thinking, well, the most obvious answer would be the power of the wave, right? Where we have a stronger, taller wave, we should expect to find high levels of mortality. So we simply measured the tsunami height in meters and then compared the mortality rates in those communities. There's a bit of a pattern, right? Some small square, but also a lot of examples that don't fit it very well. Here's Tanohata. That's a 19-meter tsunami, right? So that's 6 stories. Their death rate was around 2%, right? Iwanuma Watari also had the same death rate with a much shorter tsunami. The highest death rates were at these communities, Onagawa, Otsuchi, Rikusen, Takata. Their tsunami actually was pretty moderate. Rifu, Natori, Yamamoto, relatively small levels of tsunami. So by itself, we cannot explain mortality during this shock based only on this idea of the power of the event. The benefits of being a social scientist is I ask annoying questions, lots of them, And I spent about 8 years in Japan between March the 11th, 2011, and just about a year ago, studying this question. And I asked a lot of people, survivors, mayors, NGOs, engineers, this exact question. What do you think helped people survive this kind of shock? And I got a lot of different answers. So those of you can recognize this as a seawall, right? Now maybe here in the Netherlands it's not that big. Some of these seawalls, as we mentioned, are about 14 meters, and there are hundreds of kilometers of them. Many engineers argued and told me what really mattered during the tsunami was how tall that seawall was. Was there a berm, a dike, a polder, I think we call it here, right? Was there some kind of physical infrastructure in place? If there was, they argued, then you'd be safe. That's one argument. My colleagues in political science argued, in contrast, what really matters are politics. Maybe some communities in the area have supported the party in power, and they've gotten more support for disaster mitigation. Other communities, they argued, didn't support the LDP, and maybe they lost some of that support. It's pretty cynical, I like it. Third approach is about the power of the wave. We just talked about that, right? Maybe the argument is the taller the wave, the more people that we see killed. A lot of my colleagues in demography argue what really matters is how old these communities are. Are we looking at communities that are more elderly? Because if we are, those are more vulnerable communities, and more likely we'll have more deaths in those areas. The final approach would be this argument about social ties. What if somehow those bonding and bridging ties can activate during that tsunami to save lives? How might that look? What would the story look like? And I'll tell you one of them that I heard doing interviews in Japan. Mrs. Tanaka was in her 80s. She was confined to her bed. She saw there was a massive earthquake going on, but she couldn't move out of the vulnerable downtown area to safer, higher ground. But 2 minutes later, after the earthquake, there was a knock at her door. Her neighbor came over and said, Mrs. Tanaka, there's been a massive earthquake. A tsunami might be coming. Please come with me. Picked her up out of her bed, put her in her car, and drove her up the hill. Now that requires a lot of things, right? One, you have to know that you have a neighbor. Do you know there's someone nearby who's elderly or vulnerable and needs help? Two, you've got to put yourself at risk. After that earthquake, you also could be hurt by the tsunami and need that help, right, to get out of the area on time. What if enough people in a community trust each other and work together enough they can save each other's lives? So in fact, that's exactly what we found. In communities in Japan, and this axis is reversed. Where we have higher ties, which is here, then we have much lower deaths than communities that have lower ties, which is up here. Sorry, hard to flip this around. To the degree that if you live in a community with strong social ties, we estimate 1 in 1,000 people would be killed by that tsunami, holding everything else constant. The height of the tsunami, the height of the wave, political parties, population demography, all that stuff. But in a community where there are very weak social ties, we estimate as many as 1 in 50 people would die from that exact same wave because of that lack of social cohesion, the lack of collaboration. So we see before the hurricane arrives and as the tsunami arrives, those kind of ties make a difference. How about after the shock is done? When the disaster is over, what happens next? So I've chosen here 9 different communities in Tohoku after that tsunami to illustrate different processes and speeds of recovery. Some of them, 2 years later, right, had basically no difference in terms of their overall capacity, with 0 being nothing is online and 100 being perfect. Others have bounced back completely. Ofunato, for example, Yamada, Rikuzen, Takata. Why did some communities in Japan bounce back from the shock, and others remained unable to rebuild infrastructure, businesses, and housing? Here's some images from our fieldwork. This is the city of Ishinomaki, taken about 2 weeks after the tsunami, and taken about 2 years. So let me ask you all, you're all smart. You're in the audience, I can look at you. Do you think this community has recovered after 2 years? Yes? Why do you say that? What evidence do you have? Excellent. So all the rubble is gone, right? So this is, I think, either a bathtub or refrigerator here, right? A car's been destroyed, all the rubble's up. It's all gone again, right? What if I told you both images were taken at noon, middle of the day? Yeah, there's no foot traffic, right? There's no kids on bicycles, there's no people having lunch. So we have to be very careful talking about recovery. The debris is all gone. The infrastructure is restored, but we can't tell from this image, are businesses seeing clients again? Are children back in school, right? Do we have people buying things again? Same thing here in Tagajo. 1 month, 1 year, and 2 years. Now this white van hasn't moved over 2 years. I've got some theories about insurance fraud maybe there. I'm not exactly sure. But so again, right, thinking about recovery, we measured for this book a number of different things. Business recovery, school presence, real estate, infrastructure, roads, all that kind of stuff. Before I tell you my answer, I want to tell you one more story. So I spent, as I mentioned, a number of years in Japan studying this phenomenon and came across this huge monstrosity. This is about 2 kilometers long. Now, what does this look like, by the way? San Francisco Bridge, right? Looks like a bridge. This is actually not a bridge. This is earth-moving machinery. It's a conveyor belt, like you get for your luggage at the airport, right? But what it's taking is the remnants of this mountain all along downtown and dumping it out to raise the downtown by 13 meters. Now, I know here in the Netherlands, most of the community is underwater, literally, right? So your solution is just to build a little bit taller, right? So that's what they've done. They've knocked down all of these mountains. Notice all the rubble is gone here. The mountains used to look like this. Now they're flat terraces. They destroyed the mountains, knocked it down, ground up the rocks, and they shipped them down. Now, I heard this miles away before I got there, the sound of this machinery. It's incredibly noisy. It's like a jet engine. And as I got closer, I began to think, this is not someone's bulldozer or a shovel, right? This is $200 million US to build this. The community is only 16,000 people. It's a small fishing village. The total budget of the village is around $20 million US. So this machinery is worth 10 times more than their budget, right? So I began to wonder, how could this small village afford this kind of massive machinery? So I began asking, again, as an annoying social scientist, I asked that question to a lot of people, and I finally found out from the mayor's office, one of the people in the office of the mayor, his best friend from school is running the recovery agency. And a few weeks after this shock, he called him up and he said, can we have $3 billion to rebuild our town of 16,000 people? And the answer was, okay. Now, if you're thinking, well, of course, every village got this, right? Every village got this? No. This place that I'm calling Coastal City, right? Coastal City was the only place to get this because it's the only place that had that vertical tie between local people and someone in power. To the degree that we can actually measure across other communities, those communities with more powerful politicians, more boosters, right? Individuals with power, those communities build back better. So for example, if you only had 0 or 1 powerful politicians from your community in the central government pulling those levers, right, sending money, helping out, your recovery would be around 70%. But as you have more powerful politicians, you would actually build back more schools, more roads, and more businesses because you have that vertical tie, right, to the central government. One more aspect of recovery, mental health. Now, I know that last night they announced COVID-19 changes, right, in wearing masks. I have mine in my pocket just in case things change right now, right? That gives mental fatigue. Right? A lot of us are very tired of the pandemic, right, whether we're in Netherlands or America. We know after Fukushima, there was tremendous mental distress for many evacuees from that shock. And we've actually categorized them into sort of 3 tranches, right? Good, okay, and ugly. In the good event, you have a shock, and either you bounce right back, which is kind of right here, or you're like, no big deal, right? COVID, I can handle it, right? A disaster, I can handle it. That wasn't me, maybe it could be you, right? This is the ideal up here, right? So we call this resilience or resistance. Now, for many people, what actually happens is you have a set of shocks like COVID or a Fukushima disaster. Things get a lot worse, and then you kind of gradually go back to more or less where you were, maybe not all the way there. There's a bit of a gap here. Notice the bit of a gap, right? So maybe right now, you're not completely functioning as you did before. You're a little more tired, a little more cranky. Maybe you get to bed later, you doom scroll in your Twitter feed, whatever, right? The worst set of scenarios are dysfunction. When you go through a major shock, like a Fukushima evacuation, and over time, rather than getting better, things just get worse. It's hard to function, it's hard to go to school, you might need to be hospitalized with psychiatric illness, right? So obviously these people who lived near this nuclear power plant at Fukushima, many of them had some of these reactions. Now, 140,000 people lived within the evacuation zone, 140,000. All of them had to leave within 2 hours of the meltdowns, and some have never come home again. In fact, I take my students to Futaba, which is this community right here, right next to that yellow dot. That yellow dot is the nuclear power meltdowns at Fukushima. Now, we had, with the permission of the residents and the mayor, we interviewed the evacuees from Futaba, this nearest community, for about 5 years after the event, about everything. How things are going, how's your family, how are you doing, just to check in with them and to give them some data and to give us some insights as well. We had a number of theories about what would help people have mental resilience to these kind of shocks. The two most obvious to us were health and wealth. That is, we thought having a lot of money would make you able to resist, and we also thought that being in physically good shape would help you. There's some bad news here, I'm afraid. Across every level of income, from the very poorest Japanese we talked to, that's around $10,000 US, to the wealthiest Japanese people, that's around $80,000 US, and every level in between, no level of income reduced mental stress from Fukushima. The poor, the middle class, and the wealthy, all of them had similar levels of stress from that evacuation. For people in very good shape, right? Imagine marathon runners or whatever people do in the Netherlands to keep in shape. I don't know, go swimming and maybe go ice skating or something like that, right? It didn't make a difference. Being in physically good shape did not reduce mental stress. The even worse news, though, was if you had bad health before the evacuation, asthma, diabetes, cancer, whatever, and you went through this shock, then your mental health was even worse. Can anyone guess what one factor we found was protective against this kind of mental distress? Please. Fantastic. The best predictor of mental health after the shock wasn't health or wealth, it was having strong social connections. I want to throw in just a little bit of research because we are going through COVID right now. And by the way, if you're interested, all of these papers are available for free on our website, all of them, and all the data as well. So we began thinking about what role might these social ties play during a pandemic? How might they help us, right? So if you think about social ties and the idea of trust in each other and trust in the government, right? So we began studying what happens in communities where there is a little bit of trust in the government versus a lot of trust in the government. What happens in terms of keeping out COVID? In other words, which communities in North America and Japan got less COVID up front because they trusted the government? Can you guess which communities got less COVID up front because they trusted the government? Those with stronger horizontal and vertical ties. Those with vertical ties, the linking ties, and bonding and bridging ties, those communities had fewer cases of COVID because they listened to the government's advice about physical distancing, mask wearing, and working from home. In communities where, in contrast, there was less trust, whether it's Fauci, the WHO, CDC, whatever organization you like, those communities, unfortunately, had more active cases. Meaning, even as the pandemic is coming in, our social ties are changing our behaviors. Now, what happens over time? How might social ties change COVID outcomes? Here we're just measuring positivity rates. What happens in communities where there is high trust in each other and the government? We're finding that in communities, as social ties increase, COVID cases decrease. People are trusting each other, they're working together collectively, they're making masks, they're volunteering to help out at hospitals. A lot of the things that we saw in other shocks were exactly the same in COVID. Social ties are one way of protecting our communities against these kind of events. Okay, let's say that I'm not lying to you, and this is all true. And by the way, if you don't trust me, that's good. You should be skeptical. All the data that we used is available online, and all the papers can be tested. So if you don't believe me, that's great. Go back and test it yourself. Let's say I'm telling the truth and our analysis is right. Who cares? The good news is, if the function of a disaster is not health or wealth, if outcomes are not a function of necessarily who you are, but who you know, then this is one resource that we can build, right? We can actively build resilience by actively building bonding, bridging, and linking social ties. And this is the last part of my talk. Hopefully you recognize the guy in the red sweater. Who is that man up there who's smiling at us all? Yes, that is Mr. Fred Rogers. He's deceased now. When I was a kid, though, it was on television every day, and he said, Daniel, we didn't say Daniel, he said, be a good neighbor. Be a good neighbor. Now, if I ask this audience, how many of you know the first and last names of 10 of your neighbors, of course you'd all raise your hands, right? Because you're all civically engaged, outgoing, community-minded people, right? All of you would raise your hands, right? Nodding your heads, yeah? All 10, yeah, of course you would, yeah. 10, of course. But the sad news is, unlike you, the average people in Tokyo, Mumbai, Bangladesh, I think we did like 8 different cities, Taipei, where was we? Other cities, only 1 in 7 people can name their neighbors' first and last names. Who cares? The reality is when a disaster strikes, the first person at your door during a fire, during a heart attack, during some major shock, a flood, is a neighbor. Long before the police show up, long before firefighters get there, our neighbors are the front lines. We call them zero responders, not first responders, but zero responders. If we don't know our neighbors, they can't knock on our door and say, are you okay? Do you need help? There's a fire nearby. Come with me, let's get out of here, right? So the first thing that we're trying to do is build neighbor-to-neighbor connections. And by the way, if you Google it, don't do it right now, but if you Google it, right now, because of our lab, Australia has Neighbor Day. Australia has a lot of shocks. They've got big spiders, snakes, fires, floods, all kinds of terrifying things, right? So what they do now is in September, I think the 29th of September now, they have one day where they tell everyone, get out of your home, knock on your neighbor's door, and get to know who they are. Get a cell phone, get a Twitter handle, get something from them so you can be in contact with them. So the very first thing that our lab has been doing is building neighbor-to-neighbor connections. Now, a broader scale from the neighbor is the neighborhood. How do we connect at the block level? How do we connect to people a little bit further away? Now, this came from my old home in Indiana. This was called a block party. Now, maybe it doesn't look as much fun as your block parties, right? A little bit older, maybe. But the idea is very simple. We block the street from traffic. We bring out chairs and tables and beer and tofu, whatever you eat, right? In the Netherlands, right? We sit outside together, and we try to build social ties actively, right? We have a party, we have an outdoor event. Now, if that sounds nonsense to you, it might. You can Google this too. We've built now in San Francisco a program called Neighbor Fest, like festival, Neighbor Fest. Our program in San Francisco will give you $5,000 US every year to hold a party. Why are we giving people $5,000 every year to hold a party in San Francisco? Because they're facing a massive earthquake in the next few decades. To rebuild every building to make it seismically sound against the earthquake is impossible. But what is possible is to build social ties in each block to have them ready when the buildings do come down. Neighbors, neighborhood, citywide. How do we build a city that encourages social ties? We call this social infrastructure. Parks, dog walking areas, outdoor spots, ponds, places people can gather, coffee shops, clubs, lounges, right? The more of those open spaces we have, the more Jane Jacobs would tell us that's a real living city in communities where we have those. So we've been encouraging cities, including Boston, for example, the Rotterdam already has this, to build more areas where we can build these interactions to make trust and over time connections. Bottom left-hand corner here, a meeting like this one, someone's going blah, 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 you're all checking your email or falling asleep, right? That is democracy. Democracy comes from zoning board meetings, education school board meetings, cleaning up meetings, right? We need more and more of these kind of meetings because that's where things get done. Citizens need to be involved and trust their government for them to vote, to come out a referendum, to be involved in all these processes. So our lab helps make cities have events that are more interactive than this meeting is right now, for example. Middle of the bottom is faith-based organizations. At least in North America and Australia, churches, mosques, synagogues, spaghetti monster events, all those kind of events are what we need to build ties in people who hold those values in common. So we encourage people to think about how does your faith-based group get involved in these kind of social tie building. Last idea is community currency or time banking. What if I offered you 5 Toronto dollars, right? Those 5 Toronto dollars would come to you if you volunteer for 1 hour in the nearby pet store or whatever, picking up garbage, volunteering at a school. Your volunteer work gets you an incentive. When you have those 5 Toronto dollars, they can only be spent at small stores. No McDonald's, no Starbucks, no chains. Mom and pop stores, local farmers markets, barbershops. What we do is we build a virtuous cycle. We get you out of your home, we reward your volunteer work, and then that currency circulates locally in the area. Now, maybe this all sounds crazy. Maybe it is. But in fact, we've tried this out around the world. We now have a program called Ibasho that began in Japan and is spread now to the Philippines and Nepal. You can see our board of directors here. They're all very young spring chickens. You have to be over 65 to join the board. And the idea is very simple. This community was formed after a disaster. The people who had no social ties because they'd all been evacuated to short-term rental housing. And we said, we'll help you build a community center and you'll run the programming on condition that we can record everything that happens. So we've been watching Ibasho and their programs and measuring how successful they were at building broad, diverse, engaged networks. This program has successfully increased trust and engagement, not only in Japan, but also in other countries as well in the area. Okay, I'm gonna wrap it up now. I've tried to argue today that unlike the arguments about individual preparedness or government work, the real preparation for a disaster and the real response for the disaster comes in the middle level of community networks, social capital, bonding, bridging, and linking ties. And it's important to distinguish between the horizontal and the vertical ties. Those horizontal ties help us in the survival moments, getting us out of dangerous areas, helping our mental health as we recover over time. Those vertical ties bring us information and resources to help us leave and know what's coming, and also bring in the money and aid that we need to rebuild over time. The most critical point, I would say, of all the research that we've done is the following. Your levels of social ties and connection are not set. They can be changed and altered with interventions. That means as we face climate change, as we face extreme weather events, our cities, our neighborhoods have an easily alterable way, a policy toolkit to change things by building up social ties. Thank you very much.
Thank you. Are there any questions from the audience? May I invite you to chip in on this? Does it raise any? I'm going to lose this microphone right away. Jeroen, I'm going to bring it to you.
Yeah.
I'll get you.
Oh yeah. Well, I'll stand, it's okay.
Janine, yes.
Yeah, thank you so much for this fascinating lecture. Very interesting. So you clearly made a point like social ties help to be better prepared for disasters, but I was wondering if you have also seen that communities that might face disasters more often, so they live in a neighborhood or a country where disaster somehow strikes more often, if that helps them to, in the longer run, have these stronger social ties. So is there a link that countries and communities that are less prone to disaster lose their social ties a little bit as well? Like, is there also an inverse relationship in that sense?
That's a fantastic question. Actually, there's a big debate in the literature right now. What is the impact on a community of a shock? There's a fantastic book, if you're looking to add to your reading list, called A Paradise Built in Hell.
Yeah, I read that one.
Okay,
yeah,
fantastic. Okay, good.
Yeah.
So Rebecca Solnit argues that going through a shock brings us all closer together. For example, after 9/11 in North America, there's sort of this rally around the flag. People volunteered, they gave blood, they baked cakes, right? All the kind of stuff like that. What she doesn't say in the book, though, is what new research is finding. That lasts about 10.5 months exactly. By the 11th month, wherever you built to, you come back to where you started out again. So I guess my answer would be yes, if you had a series of shocks within a year, you probably would be at a high level of social capital because of those shocks than a community nearby that didn't have those. But the total length of that impact, the lasting length, is less than a year. There's also a great paper on the Potsdam ice event. There's a huge ice storm in New York, right? And there, over time, that drops. So yes, I think that's an interesting debate, and probably it's a short-term phenomenon.
Thanks so much. Yeah.
Sure.
Thank you. Anyone? Other questions? Yes.
Hello. Thank you for the interesting lecture. I was just wondering that if the connection of social ties and communities are very important in terms of crisis, then in what level should we then organize the most efficient crisis response? Because as we spoke earlier, we now are more likely to be sort of rescued by our community rather than individually or by the level of government. So would this mean that more investment on community responses, especially on more remote locations that are not accessible to immediate government aid, for example, is the way to go with the most efficient response?
Fantastic question. So I would say several things. One is oftentimes most disaster thinking is top down. So the government begins with a plan in mind or some kind of big reconstruction in mind, and they tell the community, here's what's going to happen. That approach to begin with, I would stop with. If you flip it around and say the bottom-up is the best, then the question is what level of bottom-up work is the most important? And here I would say it's micro-level, hyper-local. So for example, if you think about where you live, where's the boundary of your community? Is it half a kilometer? Is it 1 kilometer? For most of us, it's about 1 kilometer. So for me, I think about it this way. From my house, I put a pencil down and I draw a circle, right? That's the 1 kilometer area around the house. And I would think through, that's the area I think about as my area where I want money invested. Now, for the city, for their priorities should be, of those many neighborhoods in the city, which ones are most isolated from each other and least connected to each other? So for example, are there communities in the area that, for example, maybe there are new migrants to the area? Maybe they're really busy having 2 jobs because it's hard to avoid homelessness, or whatever it is. Those communities might be more isolated than other ones. They have fewer social ties. Wherever the fewest social ties are, that should be the government's priority of investing. I'll just tell you a really quick story. Another book to read, if you want a reading list, is a book called Heat Wave by Eric Kleinenberg. So Eric said in Chicago in 1995, there's a massive heat wave, hundreds of people died in Chicago. But the people who died were not just people who were elderly. We might think that because they're vulnerable. It was elderly and isolated. That means it's an intersectionality between people who didn't have the youth to walk around, the health they used to have, but also didn't have networks to come get them. And that for the city should be the priority. When they think about where to invest in these micro-communities, it should be those areas that intersect vulnerability with this lack of a network.
Thank you. Lydie?
Yeah, thanks a lot for this great demonstration. I think does it work? Does it work?
Yeah, it works,
Okay.
but slow down.
Okay, I can't hear. Yeah, thanks a lot. I just want to jump on that and come back on a few points. I think it's really great how you bring together different elements of sociology. And I think I still would like to come back to this debate of whether it's social ties or social structures. And I think you make some very convincing arguments about the fact that sometimes social ties matter more than health or wealth. But there are still some cases where economic and social capitals will still matter. Evacuations. You need to have some family across the country, but you also need a car. So how do you conceptualize that, as you said, intersection? And I think that's something I was missing a bit, and I'm curious to hear your answer. Because you also have a couple of theory in sociology about, for example, risk accumulation, vulnerability, that could also embody social ties.
Right.
So, how do you bring that together? And then a final point, I'm also curious. I think from about how do you think the intersection between social ties and welfare states. I wasn't surprised to hear that your reference points were your network and the market, because this is really how it works in the US. But in Europe, what protects us is the welfare state,
Right.
And that does have that does shape a lot how we think about protections of individuals. So any thought on that? I would be happy to hear.
Yeah, these are great questions, thank you. So I'll start with the middle question about intersections of social ties and vulnerability or financial resources. So I think about social capital almost like a substitute for example, financial capital in many cases. So what you saw in a number of these disasters is individuals who themselves didn't have resources, like a generator, for example, or a car, their networks did. Someone in the network had that access to that resource, and the social tie got them access as well. So, oftentimes vulnerability is talking about, for example, the most poor in America or minority communities. The reality is levels of social ties in those communities vary widely, right, from neighborhood to neighborhood. What I'm thinking about here is where you bring together, for example, the very, very poor and the isolated. That would be a community in my mind that would be the most likely to face harm during the shock. Because again, as Kleinenberg pointed out, one by itself of just vulnerable or just social ties is not sufficient. I think that's a great point. Then this broader question over time of how do we think about the welfare state? I think several things. One is, of course, North America is very, very much still a hardcore capitalist state and all the negative consequences therein. That is certainly true. But the simple reality is there's still a market here. I know because I talk to local community organizers who do have homeless people, who do have individuals who are, for example, from other countries suffering or don't have paperwork. A lot of the same challenges that North America has are also found here. And for those individuals as well, you do need that bottom-up network, right, to help them even in a welfare state. And certainly the structure here does, I think, give you some more boundaries that keeps people from having the kind of massive disaster we saw like in New Orleans, right? You had a city that had for many years faced both racial and vulnerable inequality. But I think still at the end of the day, even for welfare states, thinking about Japan, also very, very well developed OECD welfare state, there are still big variation community to community in terms of the number of variations, right? So it wasn't that every Japanese community, despite having the welfare state and nationalized insurance, was able to survive the tsunami or the Fukushima. Different communities still had different levels of social ties. So even in the welfare state, I would say, these kind of ties can make a difference.
Thank you. Other questions? No? I had a final question. It seems as if the different social ties kind of work in opposite ways. And how do you deal with that problem? Because I can imagine, the political ties are more present in wealthy communities, and wealth doesn't explain it.
Yep.
Because they might be not bonding horizontally.
That's right.
How do you discern between the effects?
I'm surprised when asked. Yeah, this is the most inequitable aspect of our research, right? Which is that at some level, those linking ties are almost random. Right? Were you friends in school with the person who became the prime minister? Right? Did it happen to be that your uncle is also in charge of FEMA distribution? Right? Did you happen to become the neighbor of someone who lives nearby with power and wealth? Many aspects of disasters are inequitable, and certainly this aspect as well, I think, is also inequitable. That is to say, these linking ties are very hard to build. Let's say I really want to meet the prime minister. We tried. We couldn't get in. They wouldn't let me nearby. They're in their limousines with bulletproof glass. Very hard to actively build deliberately linking ties. Easier to build bonding ties. So my advice to decision makers typically is much more important to invest in bridging ties. Because again, most of us easily build bonding ties. People with the same ethnic, religious, linguistic backgrounds. That's very easy to do. It's much more challenging, though, to deliberately seek out someone with a different political background, different ethnicity or nationality. So where we can actively build these ties for these kind of connections, we've often suggested we invest in the bridging area, because those, again, are often stochastic.
Great, thank you. That sounds like unless there's another question? Oh.
Wout?
Wout.
Question?
Sorry?
Oh, there. Thank you, Daniel. Fascinating presentation. My question relates a bit to some earlier questions, but I still like to ask you how you think of the following. So, did you also look into the side effects of social ties? So, can it also have an opposing effect? So if I'm well connected and I have access to the national government, for example, you gave the example of the village where people were connected to the national government, and that really helped gaining the financial means to build up their city again after the disaster. So that also means that some other groups don't have access to the same money.
Right.
So isn't it also a way to exclude other groups?
It is, absolutely, and that's a great point. The simple reality is there's a dark side, right, to social ties. Right, I mean, we know that a lot. There's Sherry Berman's work on this, for example, from Bob Putnam's work. There's a very old point that if you have very strong in-group bonding ties, it's much easier to exclude people on the outside, right? And we saw this in 2004, the Indian Ocean tsunami, when individuals who were not on the list of the caste councils, the Panchayat, were excluded out and got no aid whatsoever from the government. Same thing in North America. We know that FEMA, facing two communities, one a community of color and one a white community, often gives the white community more money with the same shock. And that's the ugly reality, again, of discrimination and how these bonding ties, which are, again, easiest to build and maintain, often have a negative consequence. Absolutely. So yes, there is a downside. The good thing, again, though, is because bridging ties can ameliorate that, right? That's the area where bridging ties can stretch beyond that. That's the area I think we can build the most in here.
Yeah.
So it's really about connecting the different groups. Yeah.
Exactly.
Yeah.
That's right.
If there's still time, I have another question. So I was wondering if you have maybe looked also at the more temporal dimension, or if it has like changed over history. Can we say that in the past, right? We say now societies are more individualist, at least in the Western world, or more secular. Like we're no longer so strongly connected to our communities.
Right.
Does that statement make any sense? Like, do you see any change over time, and is that different for the horizontal ties? I would think in the past we might have more horizontal ties, but maybe less vertical ties. But I'm really not sure. I'm just curious if you've seen if we're less prepared with our social ties than, let's say, in the 1920s or whatever, or 1700.
That's a great question. In fact, Bob Putnam is my mentor at Harvard, and he studied right now, in North America at least, if you think about the most polarized moments in history, when people had the least amount of connections, it was immediately after the Civil War in the 1860s, 1868, 1869. If you study right now, polarization is exactly at the same level that we were in 1869. So right now in 2021 and 1869, the levels of polarization, of individualization, of me versus them, we ask questions like, would you let your child marry someone from the other political party? Right now, that is at the lowest level we've seen since 1869. So again, a Republican saying not for Democrat, a Democrat not for Republican. So those are very easy ways to get at this question of how polarized are we? The good news, though, and by the way, that's true across the board. Right now, we have fewer people joining bowling leagues, fewer people volunteering, less blood drives, right? A lot of the measures that we use in North America to measure civic engagement, to measure social ties, they're down from they used to be. The good news, though, is in this polarized environment, social ties are the only bridge that we found, bridging ties, that can reduce that. So again, you have a club in common. You both volunteer at the 4-H club or the Moose club, or you both like soccer, or whatever it's going to be. Those are the very few ways we can bridge the political gap between, let's say, red and blue in North America to try and reduce that. But yes, we are very much polarized now and very much divided now as a nation.
Okay, thanks.
I saw there was a question in the back, maybe?
Yeah, sure. Please.
You take a picture.
Thank you. So basically it's because when you have these close communities, mostly migrant communities, which are very, the horizontal ties are very, very good, but then you don't have the vertical ties. But then it's hard to build those ties because there is so little trust into the government. Do you see any ways or initiatives how to build those ties?
Yeah, there's a really interesting attempt I've seen to build vertical ties, especially in migrant communities. Actually, it comes from New Zealand, of all places, which doesn't come to mind normally as a migrant-based country. But what they've tried to do is, rather than the government sitting back and doing a top-down approach, agencies leave their offices and go out into the community. So into mosques and schools, churches, local events, and they sit there for weeks and months and even longer, every week going to the same meetings so that people see them and recognize them. And maybe they ask, okay, who are you? Why are you at my meeting? And the person says, I'm from this agency, I'm from the health, from the child welfare, whatever it is. So what they've done is they flipped the script. Rather than asking individuals, trust us, we're going to come help you, the government literally goes into the community and sits there and listens. And right now, I did interviews in New Zealand before COVID, about 2 years ago. 1/3 of their time is spent embedded in the community. 1/3. So imagine a government, agent, a civil servant, rather than sitting in an office behind, bulletproof glass or whatever, they're out in the community. I think that's one of the very few ways you can overcome that distrust, but also things like, language barriers, resource barriers, right? Because pretty much if you're afraid of either migration, if you're afraid of not getting money or whatever, you're not going to go to a government agency, but if they come to you and build trust with the local leader, someone that you know, right, you're more likely to believe them over time. So I think that's one way to flip the script, to really do a bottom-up approach to governance, where we go to people as decision makers and listen to them and try to figure out what they want, and they see us there in those meetings, not just 1 time or 2 times, but for the long time. I can tell one follow-up story. There was an organization in New Zealand called the Regional Emergency Management Organization, REMO, and 1/10 of all internet traffic goes through their website. Because they've been to so many meetings, everyone goes to them first to see what's going on with them. And this is true for Facebook as well. Their Facebook page gets 1 in 9 hits in the country because people go there first. They built that trust over time. So I think that's a model for us to think about. How do we connect especially vulnerable communities, more politically vulnerable communities, right, to decision makers as well?
Maybe a follow-up question?
Sure.
Because you highlight how the internet is also important in connecting. Is there a connectedness between how much people are familiar with the internet or how good the connection is to reaction time to disasters?
Yes, this is a great question. So one of my students has been studying this. She's now actually a professor, I should say, Courtney Page 10. And she's argued several things about the internet and online communities. One is that I used to have a skepticism about, let's say, online communities and their usefulness. If you have, I don't know, Facebook friends of dogs or people who love cats, whatever, online, so what's the difference? So she's found actually individuals who are active in real life are also active in online communities, and people active in online communities are active in, so for example, they're giving blood, but they're also clicking on pictures of dogs, or they're voting, but they're also collecting the names for a petition online, right? So she's found there's actually a strong correlation between life involvement in IRL, as my kids would say, right, in real life, and in those online communities. Then the other question for us is, how does that change things? And I don't think we really know right now, honestly. So much of the last 15 years has accelerated, right, from certainly when I was a kid and my parents were kids, to the digital natives that you are all in this audience look like to me, maybe all of us, digital natives. When everything is expected to be online, we actually don't know yet. And I think if you're looking for research topics, for example, the impact that it's going to have, right, in communities that are less connected versus more, there are still communities in North America that have no broadband. They're literally using satellite internet to get up, or even some of them are using dial-in, right, in 2021, or don't have it at all. Right? And that means there's some kids who can't go to Zoom meetings, right, when their schools go online. So there is a digital divide there in terms of resource access. I don't think we know enough about that across the world right now. What will happen in countries, right? We don't have Wi-Fi for everybody as a human right or an accessible thing. I think it's a great topic for research.
Thank you.
Yeah, sure.
Hi. I was just wondering if you could reflect on the most recent crisis, so COVID, with this approach.
Yeah. So I'll leave the slide as it is. So several things. One, we saw the soulnet effect. If you think about the Paradise Built in Hell argument that when there's a disaster, people come together. In my community in Boston, there's a huge amount of volunteering. So people delivering food to the elderly. They're getting and delivering toilet paper when there's a toilet paper shortages. They're going out and making masks for people, right? They're actually knocking on doors in my community and handing out paper to the elderly who don't use cell phones, and with their cell phone with their numbers on it, and say, please call me if you need something. So a huge upsurge in that. Also, this question of trust, right? If you don't trust Fauci or the CDC or WHO, you don't trust government authorities, then no information you get about getting the vaccine will change your mind about getting the vaccine. It's not a question of information anymore, and that's a question of trust. And again, we would argue in my lab that this is a question of social ties. Where you lack trust, vertical trust in government authorities, it doesn't matter what they tell you, it doesn't matter what they try to convince you to do, unless there's a mandate, a forced movement, they're not going to move to the vaccine. So this also then can change what we do, right? So right now in North America, a number of employers have gone to mandates for vaccines, even though typically we're very against being told what to do, because they figured out it's not a question of information anymore. Now it's a question of distrust, and people are being fired now, right, in North America. People are quitting their jobs rather than, so that's how severe that distrust is. So that's another aspect of trust. And the third element is getting ready for the next pandemic. We know this is not the only one, right? Even if we have to wear masks for the next 6 months or 2 years or 20 years, there'll be other pandemics. The simple reality is information is useless if it doesn't come to me in a way that I trust. So rather than, again, a top-down communication strategy, it should be that local people in my community, people that I trust, doctors, heads of schools, whoever else I think it still has that veneer of legitimacy, those should be information seekers and givers, rather than just some mouthpiece in the capital. Because again, if you think about where you get information that you trust, it's people that are in your network, right? So part of what we have to do is, again, change this process. Rather than a top-down communication during a crisis, it should be bottom-up coming from the community.
We're wrapping up soon, so I'm collecting final questions. Annemarie, Lidi? Okay,
Sure.
Those are the last two? Yeah.
Thanks again for an interesting presentation. I also had a question on COVID. It's hard not to think of it at the moment still. I was wondering what is interesting about, of course, the COVID-19 response is that the measures we actually need to take to protect ourselves are actually distancing and isolating, right?
Yes.
So I was wondering whether that actually also limits the opportunity to connect, like bridging ties, have those bridging ties, and maybe people are more in touch with people that actually look like them, so within their own community. And if it's going too far, to maybe explain also the polarization that is now starting to arise on topics like vaccination, or still wanting to comply to measures or not, and if that's going too far, to explain it in that way.
I think those are great, and in fact, we're doing this right now in our lab, trying to understand how has COVID changed our ties. So we have mobility data right now that we're using to try to figure out, where does my phone go near your phone, and how often are they together now in 2021 versus last year versus the year before. It's a lot of work, computing work, but I think what we're finding is exactly that point, right? That oftentimes, again, you hunker down with people that you know really well. You don't go out as often to things like a mall or a park. People did take more walks, at least in North America. That was really interesting. So there was more outdoor activity, but there were fewer sports events though, right? Those are really great where there are fewer pubs that were open, fewer bars. So those are other natural ways, organic ways we build social ties. Also fewer libraries were open. So those are all social infrastructure that was less traveled. So yes, absolutely, we know across the board that social capital was diminished by those kind of activities. I think the question, again, in the long term is our society going to go to a hybrid? I know we have people at home, maybe we have people at home right now watching this from Zoom. Will a future conference, will future schooling be that there are people in the audience like this talking with people at home? And what does that do? Like, do you feel less connected to them? And I think the reality is, as an instructor at least, I definitely feel more disconnected from my students who are off campus than those who can come to campus. And I think that's one of those barriers that we'll have to overcome over time.
Thanks.
Sure.
Lidi?
One last question. I want to come back on the relation between social tie and politics. We know that on the one hand, neoliberalism has been destroying a lot of social ties and fabric communities, and also one of the criticism of resilience is that it's full of, as we say, it's very much shaped by the neoliberalism ideology because it focuses very much on the individuals and the social networks rather than discussing the importance of infrastructures and the state. So I'm curious to see, because you also mentioned, the role of the state, for example, in sponsoring those networks. So, but on the other hand, you haven't engaged so far in that debate, openly. So I'm curious to hear what are your thoughts about that.
Yeah, that's probably another book. But very quickly, I would say certainly the term resilience has been used by, like, Margaret Thatcher, for example, or Ronald Reagan in those periods of neoliberal retrenchment. when the government told communities, it's on you to fix this problem because we don't want to give the resources. At the same time, though, the reality was poor communities have always been self-reliant because the government has never fully engaged with them in the welfare states like Japan or Europe, for example, to the degree that we know the old phrase is, right, the poor get by with these kind of resources. So I think that's a good point, right? To what degree will we see that either new changes like community currency, which again is an alternative to, let's call it mainstream capitalism, where that's a local community currency that circulates locally and changes things locally. Will that be able to sort of push back against broad-strom capitalism where profits leave the community, right? We have short-term jobs, those kind of things. And I think right now in North America, I think you are seeing a bit of a pushback against capitalism more broadly. If you've seen all the discussions of right to work, or people don't want to work, or the number of people not working in really poorly paid, under-resourced jobs on the front lines, for example, in food stores and hospitality and so forth. I think you are seeing that, and also unions. Again, another form of horizontal ties coming back into the play, certainly in academia. I don't know about instructors here. I wouldn't make any political comments about Leiden, but I know in my university we've been trying to unionize, for example, right, to make those connections more explicit, right, in the ways that we negotiate, for example, with labor and management. So I think it's a great question, and we should do more research. Thanks.
Okay. Well, as we have an international audience here, I have one more question to complete the whole story. Did you find differences between different countries in applying this? It's almost miraculously how applicable it seems to communities as far as from here as Nepal to California. Did you find particular differences in its application, or which type of ties worked better?
Yeah, so it's funny. Obviously, every society's cultural framework for building these are quite different. For example, in Japan, there's the Cho Naikai, which is sort of a neighborhood association. My neighborhood in Boston would never join that. But we have the Homeowners Association, which is, again, a capitalist structure, quite different, versus Nepal, where it's completely an informal process, not at all. But the way the ties work, I would say, is universal. It wouldn't matter if you're in Tokyo, for example, or in Nepal, or in my community in Boston. Those horizontal and vertical ties still have the same role to play there. So in that sense, I guess you could say humanity has a universal element in that we do rely on groups and collaboration to get these kind of things done.
So the shape and form of ties differ, but their effect is similar.
Same. Yeah.
Cool. Thank you.
You're welcome.
All right. Good applause for our guest speaker of today. Thank you, Daniel Aldrich. Now we had a present and my colleague ran up to get it. So I had to ask another question, but now the present's not back yet. But, oh, look, one more question to fill up time. Is that okay?
Yeah. Is it on?
Okay, there it is. Hi, thank you. This was very interesting and applies so well to what we're learning right now in the crisis management course. What I was wondering relates to international organizations stepping in to help in these disastrous situations. How does that relate to how the community sort of comes together and how they accept outside help where there are no social ties and they're coming in to rebuild the society afterwards?
Yeah, this is a fantastic question. So I am a skeptic about international aid during shocks, especially because in many cases they displace local communities. For example, I used to work for USAID a lot of times after shocks in Mali, Niger, and Chad. And if there's a shock there, oftentimes we'd bring in rice or other staples and flood the market for free. But the problem was not even 15 kilometers away, there are markets, right, of local people who are selling those same products, which now just lost their entire livelihood for the next half year, right? So rather than giving scrip and having them buy from local markets, this idea that we have to come in and save them with external products, or providing tents, for example, or climatically inappropriate clothing, right? I remember in New Orleans even, we got sweaters. People sent sweaters, right? It's 100 degrees in New Orleans like most of the year. It's very warm there. We do not need sweaters. So this idea of aid, it's altruistic, it's well-intentioned, but in many cases it's disruptive to the local process. The other process, I think, is it also moves networks, right? So for example, I mentioned the 2004 Indian Ocean tsunami. One aid group brought in hundreds of fishing boats with the idea of expanding the fishing community there. But fishing is a social tie-based process. There are different roles on the boat. There's a captain, there's a fisher person, there's a navigator, there's a fish schlepper, all these different jobs. By giving everyone a boat, erect those connections and created strife. So oftentimes, I'm always skeptical when an outside agency comes in and says, we're here to help you, without knowing what's going on locally. And again, to flip the script, what I would say if they're interested in listening to me would be, they should go in and sit. Just sit, right, by survivors of that event and listen to what they need and want. And then get those things, right? And in North America, we're gradually learning to trust survivors to tell us what they need, as opposed to us tell them, here's what you need, right? Here, you need this new project, you need this new assistance. So that bottom-up process of listening, which just sounds not remarkable, right? Unfortunately, is not how most agencies work. Most agencies come in with a vision, right? We build boats, or we build tents, or we give rice, or whatever it's going to be. I can think of all kinds of examples. Oh, I forgot to mention one other thing, too. Many times after a major shock, when there's no housing nearby, the government itself disrupts social networks by moving individuals out of their community to other random locations. In Hurricane Katrina, I know this because this happened. People were put on buses to random locations. They didn't know where they were going until they got there. So there was a 16-hour bus ride and they end up in Michigan. They have no friends in Michigan. You just took them from their network and their family, right? Rather than moving as a group or as a community. So again, there are socially conscious ways we can build a post-disaster response, moving families and communities together as a group from a damaged area to a new, safer one, providing market reinforcing or social tie reinforcing processes, whether it's food or shelter, thinking through what the community needs. So I think, yes, there's a lot that we can do well. We could do well. I think we're not quite there yet of the doing well.
Thank you.
Sure.
That was because I was wondering whether it's ever actually asked for by the communities itself or whether it's like a governmental, but that makes sense. So if they tell you what they need, it's so much easier and a better way to go about it.
Exactly. And that would be true across, even in peacetime, right? So, in Rotterdam or here in Leiden, right? When the community says to you, here's what we need, rather than being told by the government, we're building a new facility, maybe the community should be asked, what do you want, right? In terms of new housing, new schools, new whatever it is, right?
Thank you.
Yeah, reflecting on that briefly, I just wanted to share my own personal experience on exactly the same thing. I used to live in Indonesia for 6 years, close to Bali, on a bit more remote location, where a lot of development projects were initiated by Western expats on community about protection of coral reefs, pollution, education, on completely different communities from where their own background was from. And you could see the goodwill on all of these projects, that people really had moved to the area, wanted to bring their Western expertise in. But then not many of these projects actually were carried on by the community because they were not done in a way that actually asked what sort of participation was needed. So we as Westerns, not myself, I wasn't involved in those kind of projects, but it was very clear to see that there was this idea of a rescuer, and then you give something and the community needs to accept what is being given, and there wasn't a dialogue between the person that was being helped. So then a lot of resources were wasted on this kind of activity. So I just wanted to share that because that's very relevant. Yeah.
Exactly. And I would add two things to reinforce that. One is we can have great ideas as technocrats of the ideal solution to a problem, but if the local community doesn't buy into it and support it, it doesn't matter at all. So I can have a great vision for what to do in community X, but if they don't want that, it's going to last maybe 6 months or a year before it dies. Only communities that support it will go longer. I forgot my second point. Anyway, but yes, that's a great point, though, right? We need that community buy-in, right, over time to make a successful recovery.
Okay, thank you. Thank you again. And we now have a small present for you as a token of our appreciation. It's a Leiden University, what do you call it? A cash card dispenser? Where the right, it's the card. So it's where the right card comes out. Like a wallet, but then for cards.
Okay, I need some cash in my wallet then in that case. Hold on a second.
I don't know. It doesn't open, but it's...
Ooh, that's gorgeous.
So, if you get paid for your next...
Thank you very much.
so much.
Thank you all so much.
All right.